Acute kidney injury and treatment methods. Acute kidney injury (AKI) is a serious medical condition characterized by a sudden decline in kidney function, leading to a buildup of waste products in the body. This can cause complications like fluid retention, electrolyte imbalances, and even coma if left untreated. 1. Peritoneal dialysis. 1. Peritoneal dialysis. Peritoneal dialysis utilizes the patient's own peritoneum as a natural filter. A sterile solution, called dialysate, is introduced into the peritoneal cavity through a catheter placed in the abdomen. The peritoneum acts as a semi-permeable membrane, allowing waste products and excess fluids to pass from the blood into the dialysate. Acute peritoneal dialysis. Acute peritoneal dialysis. This method is often used for managing acute kidney injury or exacerbations of chronic kidney disease. A temporary catheter is inserted into the peritoneal cavity through the abdominal wall. Typically, 2 liters of dialysate are instilled, left in place for a couple of hours, and then drained. This process is repeated several times a day until electrolyte balance and kidney function are restored. B. Chronic peritoneal dialysis. In cases of end-stage renal disease, chronic peritoneal dialysis can be a viable alternative to hemodialysis. A permanent catheter is surgically implanted, connecting to a bag containing dialysate. Patients can perform peritoneal dialysis at home, typically 34 times a day. 2. Hemodialysis. 2. Hemodialysis. Hemodialysis is a procedure using a machine to filter the blood, removing waste products, excess fluids, and regulating electrolytes. Blood is drawn from the patient's body, passed through a dialysis filter, and then returned to the body. This process is typically performed in a hospital setting, 34 times a week, for approximately 34 hours each session. Peritoneal dialysis. More convenient than hemodialysis, allowing patients to perform treatment at home, with minimal disruption to daily life. Lower risk of hypertension and cardiovascular complications. Requires strict adherence to fluid exchange schedules and catheter care. Peritoneal dialysis. Potential for complications like peritonitis, infection of the peritoneum, and catheter malfunction. Hemodialysis. More effective at removing waste products compared to peritoneal dialysis. Greater control over electrolyte and fluid balance. Requires regular hospital visits, taking up time and resources. Higher risk of hypertension and cardiovascular complications. Choosing the right method. The best treatment method for each patient depends on factors such as their overall health, lifestyle, ability to manage treatment, and financial considerations. A healthcare professional will assess the individual's needs and recommend the most appropriate treatment plan. Note: both peritoneal dialysis and hemodialysis can significantly extend lifespan and enhance quality of life in individuals with acute kidney injury. It is crucial to choose the right treatment approach, adhere to treatment plans, and prioritize health management to maximize treatment effectiveness and minimize complications.